Hi, I'm Weimar B. Callado from Section Weidenbach. For this video, I will perform skin application. But first, what is skin application? A drug is applied directly to a body site. For the assessment, observe for any lesion, rashes, or areas of erythema and skin breakdown. Assess the patient for any allergies. Verify patient name, dose, route, and time of administration. Assess the patient's knowledge for medication and procedure. If the medication affects the patient's vital signs, assess them before administration. For the objectives, first, to promote absorption of medication more rapidly through the use of certain topical medication. Second, to treat skin disorder and lesion caused by burns and abnormal growth. Third, to dilute effects of the drug. Local action may be less than systemic. Fourth, to apply an agent that stops or prevents the growth of microorganisms. Fifth or last, to provide a local anesthetic to specified parts of the body. The equipment used for this procedure are medication card, medication container, application tube if needed, tongue depressor or tongue blade PRN, gloves, and sterile gauze if needed. Step 1. Gather equipment. Check medication order against the original physician orders according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. Step 2. Know the action, special nursing consideration, and safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder, and can also be used to educate the patient about the medication. Step 3. Perform hand hygiene to prevent the spread of microorganisms. Step 4. Place medication on tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Step 5. Transport medications to the patient's bedside carefully, and keep the medication in sight at all times. Careful handling and close observation prevent accidental or deliberate disarrangement of medication. Step 6. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and helps prevent errors. Step 7. Explain procedure to the patient to gain cooperation and to allay anxiety. Step 8. Cleanse skin surface with soap and water unless contraindicated by patient's condition. Dry thoroughly. Remove old ointment and replace with a new one. Step 9. Squeeze medication from a tube or using a tongue blade. Take ointment out of the tube or jar. Step 10. Spread a smooth, thin quantity of medication evenly over patient's skin surface using your finger or a tongue blade to provide an occlusive effect. Step 11. Protect skin surface with a dressing if needed, so that medication cannot rub off. Step 12. Assess the patient to a comfortable position. This ensures patient comfort. Step 13. Evaluate patient's response to the procedure and medication. The patients need to be evaluated for any adverse effect from the medication or procedure. Step 14. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Evaluation. First, skin returns to normal state. Second, desired therapeutic effect is obtained. Third or last, experiences no adverse effect including allergy response, systemic effects, or injury.